And members of the medical community are also reaching out to help young people cope with this tragedy. Joining me now is Dr. Ryan Matlow, a child psychologist with Stanford Children's Health. Doctor, thank you so much for joining us.
Thank you for having me. It's a pleasure to be here.
Now, can you talk a little bit about how your team has worked to help students cope after the Half Moon Bay shooting?
Well, one of the main things we've been doing, I appreciate recognizing the work that a lot of community organizations are doing to support the community. And I think one of the things that we've been focusing on is how best to support these community organizations, the folks that are really at the front line. We know, Ayudando Latinos a Soñar, ALAS, is one of the primary groups that has responded to this tragedy amongst many others. And so we've really been looking to support them, to help them build their capacity and resources for both identifying and addressing the needs of the farm market communities that they serve. And it's been really remarkable to see the spaces that have been created and cultivated to provide a space for communities and families to grieve, to recognize the impacts, and to provide these healing spaces. And so what we really want to do is support the folks that are on the ground and these community organizations that are their day-to-day working with the farm worker families and farm worker communities in their daily lives.
Now, how has the shooting impacted the mental health of the kids living in this community? How have they coped with this?
Yeah, I mean, the responses are varied and complex. And one thing I want to say is that, many kids are incredibly resilient and recover and will experience some distress, but also will adjust over time. And that is, in many ways, dependent upon the support that they get from the adults and systems around them. Again, these community spaces to honor and grieve and recognize the impacts. At the same time, we know that, there are many kids that continue to struggle and continue to experience a negative impact from either the direct or indirect exposure to the shooting, to this tragedy. And so, this surfaces when kids don't have access to the safety supports or resources that they need. And also sometimes when they face additional traumas or adversities or violence exposure. And we do know, unfortunately, there have been further experiences of violence. And so the stress accumulates and affects how kids show up in their homes and in schools and in the community.
And all too often, especially here in the news, we talk about mass shootings that are happening across the country. And there's debate and concern for parents and caregivers wanting to know how should they talk to their children about mass shootings and what is age appropriate. Can you give some advice to parents on whether that conversation should be parent-led, or is it up to you to wait for your child to bring it up?
Yeah, it is a challenging question as a parent, a challenging kind of position to be in. In general, the bottom line is that we want to follow kids' leads. Oftentimes, we want to provide an invitation. We want to acknowledge that an event has happened in their community, that a tragedy has happened, and not avoid it or sweep it under the rug. So it can be important to acknowledge it, but ultimately, we want to follow kids' leads and just invite them to ask questions, to share their experiences. And ultimately, we do want to spare kids from the details and the specifics, kind of the horrors of the incident that kids don't necessarily need to see or hear about. And we can focus more on how they're affected or impacted. What are they thinking and feeling, and really help them express, articulate, and learn and practice, what works for them to deal with the impacts that they're experiencing. Maybe they're feeling worried, maybe they're experiencing fear, nervousness, right? And so focusing more on what they experience and the impacts of these events and tragedies is the primary role that parents and caregivers can offer.
So the key takeaway is just provide the space for them to express how they're feeling about whatever happened.
I think so. And of course, there will be challenging things that can come up in that as we open up that space. And so the other thing that parents can be thinking about is, how do I bring supports to my child, right? To connect with professionals, help to have conversations with doctors or teachers or mental health professionals when it gets to the level of kind of complexity or nuance that may be understandably challenging for a parent to know what to do with, right?
Sure.
And so there are supports and resources that are out there. This is a collaborative effort, right? A community healing process.
All right, Dr. Ryan Matlow with Stanford Children's Health. Thank you so much.
Thank you.